So the question reads, you're caring for a patient with esophageal cancer. Which task could be delegated to an unlicensed personnel? So the options are as follows. Option 1, assisting the patient with oral hygiene. Option 2, observing the patient's response to feedings. Option 3, facilitating expression of grief or anxiety. Or option 4, initiating daily weighings. All right, so let's talk through the options, okay? So we know that we're dealing with an unlicensed personnel. So let's just say you're the nurse, you're on your shift. There are multiple things that you're juggling with as far as priority. What is something that you may want to delegate to somebody who is not licensed? So, your nurse aides that you typically work with in the hospital setting. Out of these options, which one is within their scope of practice? That is what the stem of the question is asking you. What is within the scope of this unlicensed personnel? So if we go through each option, option 1 is assisting the patient with oral hygiene. We know that unlicensed personnel are there to help with activities of daily living. So brushing, bathing, feeding, dressing, you name it. Anything pertaining to day-to-day activities that the patient may need assistance with, they can do that. That is under their umbrella. So doing oral hygiene is definitely within their scope. So far, option 1 is looking great, but we continue. Option 2, observing the patient's response to feedings. Now, when you're observing or assessing or seeing the outcome of something that you've done, that is within the nursing scope. To me, option 2 is more of an evaluation. You've observed this, now you're seeing the outcome of what you did. So it's saying you're observing the patient's response to feedings. You're evaluating to see if they've tolerated it or if they didn't tolerate it. That is not within the scope of an unlicensed personnel. This is giving more of a licensed practical nurse or a registered nurse. We continue. Option 3, facilitating expression of grief or anxiety. Anything with facilitating, educating, assessing, executing, that is not within the scope of an unlicensed personnel. So even if you were confused, the wording of facilitating is never something that an unlicensed personnel will do. They receive demands from the higher ups, which are the LPNs and RNs, okay? So facilitating expression of grief or anxiety cannot be in the scope of unlicensed personnel. And lastly, option 4, initiating daily weighings. So this could be tricky. So if some of you guys selected this as the correct answer, I can see why you did, because an unlicensed personnel can weigh a patient daily, but what really triggers this being incorrect is the fact that it started with initiating. Anytime you see initiation, especially with daily weighings, we don't know if this person has CHF or the reason. It doesn't give us too much, but we know usually with daily weighings, it's typically an order from a physician, and that order would then be carried out to the nurse to then execute. So the nurse, she can delegate that task. So an unlicensed personnel can do the daily weight, but as far as initiating the actual thing, that is where the unlicensed personnel cannot do. So again, make sure you're reading through the options, reading through the questions very carefully. This is how it can stumble or trick some people. Yes, they can do daily weighings, but they're not the initiators in that process. And I hope that kind of brought some clarity. And with that being said, option 1 is the correct answer. Assisting the patient with oral hygiene is definitely within the scope of unlicensed personnel.